Today, we have gathered again for an enlightening talk on fighting obesity in sedentary lifestyle. Last month, if you remember, we talked about mental health. Today, this will be on physical health or on a very important topic, that is obesity and sedentary lifestyle. Before we start, there's some house rules. All videos must be turned off except when the photograph is taken via screenshot. We have our council photographer here who will be doing that. Your audio will be kept muted during the presentation. Video recording of the event will be done and it's actually ongoing. There will be some poll questions. Please do participate in it because the speaker can gauge the situation based on those polls and modify his talk accordingly. If you have any questions during the presentation, you can please key them in the chat box. We will address them later at the end when the presentation is finished. The idea is to let's learn together. Moving on, we're going to talk about Dr. Andrew. Before we proceed, let me tell you that he's our alumni from batch 1515. The inspiring part when I read this was back in 2013, Andrew was misdiagnosed with pancreatic cancer and nearly underwent a major operation. The near-death experience changed his approach in his medical practice. From that moment, he pledged to always look for the root cause of diseases when he treats his patient. And with that in mind, he founded Sweet Lives Wellness Center in 2017. So apart from that, I know Andrew not just as a student of mine, but also as an avid Toastmaster, winning awards after awards in the speech contests. He is joined by his sister, Jasmine. Now, Jasmine is also our alumni from batch 25. Jasmine is now a wellness trainer, and she has given multiple talks in many schools, and she's very passionate about educating and making people aware of wellness and healthy living. Now, before we go into further introduction, Andrew has made my life very easy by giving a 1 minute 10 seconds video, which I'm going to play for you, that will summarize everything about Andrew for the moment. Sorry. That's Andrew for you. And let me welcome Andrew to take over and hand over the controls to Andrew, who is also a very avid Toastmaster, as I mentioned to you. Andrew, back to you.
Thank you, Professor Som. It's truly an honor to be invited for this talk. And Dr. Jasmine and myself, we have both given, I believe, nothing less than 500 talks in the past probably 3 to 5 years. And I think some of the talks that we've been giving includes stress management. I believe today is the day I actually needed the stress management myself. Okay, so without further ado, let me share my screen first. Okay. Okay, is this good? All right, so let's get started. 7 years ago in 2013, I was wrongly diagnosed with pancreatic cancer. And this is the scan that was done on me. And behold, this was done in Malacca General Hospital itself. So what happened was in 2013, I was having a very mild, abdominal pain that was dull aching in nature, and it was disturbing my sleep. So that time I was actually working in the radiology department. I was in my first year MO, medical officership, in General Hospital Malacca. So I went back to my own department and I got myself a scan done. So I actually did MRI and I also did CT scan. And this was what they found. They found this growth here, which is as big as a ping pong ball. If you remember, I actually represented Malacca for ping pong. So God always has his own funny way of, since you're so good in ping pong, let's put a ball inside your, inside of them. And this is what they found. So when they found this growth, obviously the first thing that they suspect was obviously a carcinoma. And that time, my friend, who happens to be a hepatobiliary surgeon, some of you may know who is he, actually in General Hospital, and he offered me an operation. He said, you know what, Andrew, let's go for an operation. He offered me Whipper's procedure. I believe you all know what is Whipper's procedure. So at the point of time, I asked him one question, and I asked him, I said, brother, are you sure this is cancer? Well, he couldn't answer me. And so when he couldn't answer me, I told him, I said, no, I don't think so. I don't think we're going for Whipper's procedure so soon, because it was actually scheduled 1 week immediately after the scan was done. I told him, no matter how I insist to find out what exactly is this. So from Malacca Hospital, I was transferred to Selayang. Okay, so Selayang is in Kuala Lumpur. So in Selayang Hospital, they did a scope for me. So they put in the camera through my mouth. Okay, so obviously it went all the way down. And I was very lucky that this was actually at the head of the pancreas, which was very close to the duodenum. And from the duodenum, so they actually did a biopsy for me. And then they found out that this was actually a granuloma. Okay, so it was actually a granuloma. Wait, is it a granuloma? A granuloma. Okay, so it was actually a TB infection. Okay, so they found out it was actually a TB infection, and because of that, I escaped the operation. So no Whipper's procedure for me, no chemotherapy for me, and I was lucky enough that I was only put on 6 months of antibiotics. So we know anti-TB for this. So I suffered for a good 6 months. However, I think I'm still very lucky to have actually escaped the operation. And it was because of this near-death experience, I told myself from then onwards, every time I see a patient, I must always look for the root cause and not just by treating the symptoms. And this is how I started Sweet Life Wellness Center. And today, ladies and gentlemen, and my dear professors and all my lecturers, today we are going to go deep into this root cause of obesity, diabetes, and hypertension. I believe every one of us we have agreed that these three always come together because they are all interlinked. And because of what we have been doing for the past 3 years, and this is actually what happened. I was interviewed by Bernama TV. This happened last year on the 14th of November, which is World Diabetes Day. And I was interviewed because of what we have been doing for diabetic patients. So as in what we've been doing for diabetic patients, we are going to find out now. All right, so I'm going to share a little bit, a few of the testimonials from my patients. So this patient, Yi Moyong, by the way, all these patients whom we are actually showing, they have given us the consent to basically share their testimony. So you can read from here. I have been suffering from diabetes since year 2000. So, and when she saw me was actually 2018. That means diabetic for the past 18 years. And by the way, this is type 2. Was on oral medications, escalated to insulin injections, which is very common. In spite of all these medications, my blood sugar is still not well controlled. which is also very common. After seeing Dr. Andrew a year for his reversing diabetes program, I am no more on medications and insulin for my diabetes. So I literally drop off all the medications and insulin. So I know some of you might be thinking, am I giving some supplements to her? No, the answer is no. We hate supplements in Sweet Life, so we do not prescribe any supplements as well. So she wrote here, I'm no more on medications and insulin for my diabetes. Weight-wise, I have also lost 20 kg. This is a 1 year's result. And my blood pressure has normalized. Overall, I'm very happy that my total health has improved. Thank you, Dr. Andrew. Let's look at the next slide. So this is her. This is Yi Mo Yong. You can see that before she started, it was 96 kg. And after about a year, so this is a 1 year progress, she is now 75 kg. So she dropped about 20 to 21 kg. No more insulin injection. Her insulin injection used to be 80 to 100 units per day. Okay, and she's also no more on OHAs, okay, and also no more on antihypertensive. This is one of my patients. In fact, I'm very thankful to her because she's actually one of my very first patients who is on this program. Next up, I have this patient having been diagnosed with hypertension 30 years ago. Okay, this is even longer than just now, 1990. I thought I had to be on medications all my life, which is the common practice. Over the decades, the dosage of my medication only kept increasing. But after consultation with Dr. Andrew, every month I could reduce my drug dosage. Now, after 7 months, I no longer need any medications. I've also dropped 12.1 kg in these few months. And for information, this patient of mine, she is actually suffering from an autoimmune disease, and she's also on very high dosage of these steroids. Okay, and her steroids requirement has also come down over the past more than 7 months. Okay, by now, and let's take a look of her picture. Okay, so this is her. This picture, what is shown here is actually a 15 kg drop. Okay, it's actually more than 12 kg already, because this picture was sent to me quite recently. She's actually a teacher, and recently the school was reopened. So she told me, she said, you know what, doctor, most of my colleagues had to go and buy new clothes. I say, yeah, most of them had to buy new clothes because they put on weight, right? Because of the MCO, not much workout, and then they're all at home just eating and eating and eating. So they've all put on weight. So I say, good for you. You don't have to go and buy any new clothes. She said, no, I also have to go buy new clothes. I say, why? I say, my clothes are too loose for me now. And she said her gym, she also has a gym instructor. She said her gym instructor is telling her that, you know what, you are looking like a small little girl now wearing some very loose clothing. So this was actually being told to her. So this was another testimonial that we have. And this is what she sent to me, okay? So if you're still thinking what she's eating, let's check this out. Doctor, no wonder you said take self-photo now. So I always tell my patient, before, after photo. Past 5 days after I send you the readings, drop another 1 kg. Wow, can indulge in macadamia nuts and KFC. Yes, you read it right. Kentucky Fried Chicken. My patients, they are not taking some very dull or bland food, okay? They are taking very interesting, tasty food, okay, for them to actually reverse their condition, and we will get into that soon. Next, okay, this will be my last testimonial for my patient before I pass the time to Dr. Jasmine. This is one very recent one. Okay, so just in case any one of you here, especially for those of you who are not healthcare professionals, okay, after this, if you know the techniques to go about, and if you're on medication, okay, especially you're on OHA, the diabetic medications or insulin, please do not do it yourself, because this might happen to you. This is exactly the screenshot of what happened to my patient. She started out with 73 kg on top here. It dropped to 72 kg, dropped to 79.3 kg. This is about 3 kg. And if you can look at the date, it's from the 8th of August to 21st of August. It's barely 2 weeks, and she dropped 3 kg. But this is not the scary part. The scary part is, please take a look of her blood sugar. You can look at her fasting blood sugar. She saw me on the 7th of August, the first consultation, 7.9, the first day that she actually applied the diet plan. And look at how the blood sugar actually dropped. Okay, she actually went into hypo because there was one time she had this hypoglycemia, the glycemic symptoms. Her sugar went to 2.9. She was on 70 units of insulin when she started. She was on metformin. Okay, and in less than 2 weeks, I dropped off her metformin, and I also reduced the requirement of insulin for her. And you can also see the result from the 2 hours after dinner here. as well as look at the pressure. The blood pressure is also coming down. She's on amlodipine, by the way. So this patient of mine, she's very young. She's only 40 years old, a lady, Chinese lady. And she started having diabetes at the age of 18. So it's 22 years diabetes. And this is what is actually happening to her. And she told me, she said, "Doctor, I just couldn't believe it that, you know, while I was on these diabetic medications and insulin, my sugar never dropped below 8. And now, even when I was not on that high dosage of medication, my sugar is less than 8 and my weight is dropping and my blood pressure is also dropping." All right. So we're going to share with you what exactly we did to these patients. What did we actually prescribe to them that they actually achieve this kind of results? Okay, then the next one. Okay, this is Dr. Jasmine's patient. I would like to invite Dr. Jasmine to share a little bit about her patient.
Hi, okay, very good afternoon to all my beloved lecturers. This is one of my patients. Okay, as you can see, his name is Mr. Lau. When he saw me, it was February early this year. Okay, and he was very desperate because he has tried a lot of supplements already before us. Okay, and he found us when he found us, he was about 128 kilos, and currently, after about 6 months, he's currently 114 kilo. So he has dropped about 13 kilo in about 6 months time. I managed to take off out of 7 medications that he was on when he saw me. Now he's only on 3 medications and he's no longer on any diabetic medications.
All right, let's move on. Okay, the next
on to the next one. Okay, this patient is from Johor. Okay, because we do online consultation now. Okay, this is happen to be in Johor, and as you can see, he's 60. This patient is 66 years old. She's on 52 units of insulin every day. Okay, she has been diabetic for about 15 years already.
20 years.
Oh, 20 years. Okay, 20 years. Okay, and now she's no longer on insulin anymore, and her blood pressure even come down to normal. Okay, from the borderline. She's not on any antihypertensive. Okay, from that borderline until now, it has come down 131/68, and without those medication, she already lost a few kilos, and she feel very energetic now. As you can see, she wrote there, "My belly looks like I'm 4 months pregnant before that." And now her pant size even dropped from size 12 to size 10.
All right, moving on. Okay, so a little bit of disclaimer. This is more for those who are not medical doctors. So the views and opinions presented are based on our own research and clinical experience. Myself, I've been practicing for the past 10 years. As Dr. Som has mentioned, I'm from batch 15 and Dr. Jasmine is from batch 25. So she has 5 years of clinical experience. And of course, please consult your own healthcare professionals before you make any changes to the medication and lifestyle. This is especially because we are very worried about hypoglycemia as well as hypotension, especially if you're on medication. If you're not on medication, feel free to basically apply the techniques that we're going to share after this. Okay, in this presentation, diabetes is being referred to as type 2 diabetes unless we mention otherwise. Okay, this is for from Dr. Jasmine and myself. Okay, so we're going to go into the first poll. Okay, so we would like to have a vote from everyone. As in, what do you think is the root cause of obesity, diabetes, and hypertension? What is the root cause of obesity, diabetes, and hypertension?
I've released the poll. Can you see it?
Yes, thank you, Prof.
You can end the poll yourself if whenever you feel.
Okay, all right. Prof, is there any pressing questions for us now at this moment while we wait for the poll?
No questions.
Okay, all right.
Do you want to display the results for everyone or just?
I think we can display the results.
Okay,
Yeah.
so
Yeah.
once you let me know, I'll end polling and we can
Uh,
display.
yeah, I think we can
Someone asked, is there all of the above?
is that all the above?
Zainuddin has asked that.
Okay, I think we can end the poll. I think we have
Okay.
about 76% voted. I think it's which is
Okay,
quite good.
right.
Yeah.
So
Okay.
I'll be sharing the poll,
Okay. All right.
the results. Can you see the results?
I can obviously see, but I'm not sure about the rest. Can everyone see? Is everyone?
Can just give a reaction button, everyone, please. I mean, yes, I think everyone can see that.
Everyone can see. Okay. All right. Well, I will have to say I am a little shocked by these results because I never expect too much carbs to actually come as the champion. Yeah, I'm seriously shocked. I'm not joking when I say this. Yeah. Well, so it actually makes my life easier now since many actually kind of know the basic concept behind this. And yeah, so okay, based on our understanding, both Dr. Jasmine and myself, and also based on our experience in reversing obesity, diabetes, and hypertension, the root cause is actually carbs. So, and we're going to we're going to look into this deep after this. Okay, so let us move on to the next slide. You can stop sharing, right? Okay. Can I move on with the slides?
Yes, please.
Okay. All right. So, I'm not sure whether should we move on with this or not. Okay, now mind. Okay. So, yeah, let us see what is the. Let's move on to the second poll. How many of you are actually familiar with this food pyramid that you can see here? Okay, so this food pyramid here, as you can see, at the lower part, there's all the carbs, the bread, the cereal, the rice, the pasta, followed by the vegetable and fruits, followed by the protein, followed by the fats and oil. Wow, okay, okay. All right. Okay. Oh, not bad, not bad. Yeah, we have very good response from from everyone. Okay, which is good. Okay, seems that everyone is familiar. Prof, do you want to show the result?
Yeah.
Yeah. Okay, so we have up to 89% of everyone here who is familiar with this food pyramid. Just for your information, in fact, we have been very, very disciplined. The whole society, the entire society has been very disciplined in following this particular food pyramid, which I will explain a little bit more after this. And we will see whether this food pyramid is doing us good or doing us more harm. All right, so let us move on. Okay, can I share the, okay. All right, can I move on to the next slide?
Yes, please.
Okay, so let's take a look of this particular food pyramid. So this food pyramid was actually launched by the USDA, the US Department of Agriculture, back in the 1980s. And you notice that at the top part here, at the tip of the pyramid is actually the fats, the oil, and of course they also did place the sweets there, although sweets somehow was not regulated that much. As you can see, our food and beverage are all filled with so much of sweets. So they actually put this fat here, okay, and thinking that, you know, fats is really bad, and you know what, you know, fat is the one that is making us fat and things like that. Okay, so and over the lower part here, you can see at the base is actually all the bread, the cereal, the rice, and the pasta, and which we have also been very disciplined in terms of in terms of taking this. Okay, sorry, where am I? Okay, wait, I couldn't see myself. I'm so sorry. How do I make it see myself? Okay, all right. So you can see here the lower part. Okay, so it's actually about easily 50% of our food actually consists of this, and then followed by this vegetable group as well as the fruits, and then followed by this milk, cheese and all this, and then also the meat, the poultry, the fish, the dry beans, eggs and things like that, and then finally the fats. So when they first came up with this, and they actually thought that by the year 2000, that means about 20 years down the line, our humanity will not suffer from obesity, hypertension, and diabetes anymore. This is actually what they had in mind when they came up with this particular food pyramid. And you think about it, the society has been very disciplined in terms of following this. Just look at what you actually find when you go into any restaurant now. You walk into any restaurant, you walk into any supermarket, you walk into even the, even probably the wet market, you will notice that it's actually the food that are being sold in terms of ratio is actually in this particular format. There are a lot of all these bread, cereal, rice, pasta, and everything, then followed by vegetable and fruits, and then followed by meat, poultry, and then followed by the fats. So we have been following this religiously, and what exactly is happening to us now? Okay, so and this is what we can see. All right, so it says here the FDA to retool the food pyramid, citing consumer confusion. So what exactly is causing this obesity? Okay, as you can see from this, if you actually relate, all right, you can see that this particular carbohydrate, which is down here, and which is contributing to the what we call the belly fats. All right. And you can also see from this in the Time magazine, back in 1984, which was the year I was born, it says that cholesterol is the bad news. And 30 years down the line, in 2014, Time says that, you know, it's time to actually eat butter. It's time to actually eat butter. The question now is, how exactly is this food pyramid causing problem to us? All right. So you can see that these fats, this carbohydrate that is here. What happens when we actually ingest carbohydrates is that we know that our body doesn't keep carbohydrate as carbohydrate. Okay, so one of the first thing that the way it actually keep is it actually keep it in a glycogen form. And then, you know, glycogen form is actually the limited form because we cannot be keeping too much of this glycogen. And then after which is going to be converted into fats. All right. And how this carbohydrates is being converted into fats is actually through this thing called the insulin. So insulin is the key to making all these fat cells fatter. So by drawing all this glucose into the fat cells, okay, it actually makes the fat cells fat. And we know that it's the carbohydrate that make us to be fat rather than the fats that are actually making us fat. Okay, so let us move on. So in order to understand the root cause of diabetes, hypertension, as well as obesity, we need to understand this graph in depth. Okay, so we need to understand this graph, this particular table in depth. So let us now move on to infection first. Okay, so in order to understand this, we understand what is infection. But let's say we have a bacterial infection of the throat. So a pharyngitis. And let's say we know that the root cause is now due to bacteria. So as doctors, what do? We will prescribe antibiotics to the patient, right? Antibiotic to kill off the bacteria. So the root cause treatment for this bacterial infection is obviously antibiotic. But someone who come in with a pharyngitis will obviously have some symptom, for example, fever or even cough, flu, sore throat, and things like that. And then what do we doctors do? We give them medication as well. All right, we give them paracetamol, we give them some cough syrup and things like that in order to treat the symptoms. So what happens if we only focus on this part? Let's say we know very clearly it's a bacterial infection. Okay, we saw pus pointing, we saw high grade fever, and then we probably took the total Y is high. Okay, and we only focus on symptomatic treatment by offering only the medications for symptom. What is going to happen to the patients? We probably agree that the patients either they don't recover or they take very long to recover. So I believe everyone here will understand this concept here. Okay, so now let us move on to diabetes. Okay, so diabetes, hypertension, as well as the obesity. What is the root cause? Okay, so let's move on to symptom first. We are always talking about high blood sugar for diabetes. Okay, well and behold, high blood sugar is actually only a symptom of diabetes. And most of the time when we take example, insulin or even oral hypoglycemic agents, okay, most of it, if not all, most of it, they are trying to bring down the blood sugar rather than to treat the root cause. The question now is, what is the root cause? Okay, so the root cause is none other than these two words here, insulin resistance. And what is insulin resistance? Okay, so in order to understand insulin resistance, we need to understand alcohol resistance. So what is alcohol resistance? So we know someone who drinks, when they first started drinking, they will probably drink like what, 1 pint, 2 pints, and then they're drunk. But you notice that after they drink for some time, the longer they drink, they will start to realize, hey, actually this doesn't work anymore. I need more. I need 3 pints, 4 pints, 5 pints in order to get drunk, right? So our body developed resistance towards the alcohol. So it's alcohol resistance. And it's not just for alcohol, it's for any drugs for that matter. This is the reason why for any long-term medications, the longer you take, okay, the less effect are those medications. Example, we also develop virus resistance. Someone who has developed, who has gotten chicken pox before, okay, they develop resistance towards the chicken pox. They don't get it the second time anymore. So we develop resistance towards that as well. So we also develop resistance towards any chemical, okay, that is actually present. Example, alcohol. So now back to the alcohol. So let's say we want to treat someone who suffer from alcohol resistance. What are we going to do as doctors? Okay, so let's say someone come to me. Okay, and okay, let's say now, Prof, can you unmute yourself?
Yeah.
Yes. Okay. So let's say now I'm the alcoholic. Okay, and I come to you. I say, doctor, I need some help with my alcohol. You know, this alcohol addiction, alcohol problem. How are you going to help me now? Okay. Let's say I narrow down to only 2 options. Option 1, you will tell me. You say, Andrew, since you are not drunk even with 2-3 pints, let's go for 4 pints, 5 pints, 6 pints. The more you drink, you get drunk, and then the problems will be solved. That's the first option. Second option, you will tell me, okay, Andrew, let's do it this way now. You slowly bring down your alcohol consumption, okay? We slowly taper it off so that you don't have that resistance towards alcohol anymore. Okay, so Prof, which one would you ask me to go for? Option 1 or option 2?
Option 2 looks more possible.
Option 2 looks more possible. Yeah, that's right. So we want to actually reduce the alcohol so that, you know, we actually get better in terms of alcohol resistance. Now, think about it. Patient in a type 2 diabetes is suffering from insulin resistance. So that means there are too much insulin in the body for the patient. And we know that this insulin is driving the carbohydrates into the cells that is making the patient fat. That is why in type 2 diabetes, you notice most of them are obese. They're overweight because they have too much of this insulin in their body. And over time, insulin resistance happens. Okay, that's which actually end up with type 2 diabetes. That's why most of these type 2 diabetes, they are obese. But type 1 diabetes, you notice on the other hand, no matter how you feed them, as long as they don't have they don't have insulin, they will be very skinny, they will be very thin, they will be underweight. So insulin resistance, patients having too much insulin. What are we doctors giving to the patients? We are giving them even more insulin. It's like, let's say Prof, okay, decided to play a prank on me and say, Andrew, let's go and let's drink more alcohol so that, you know, you still get drunk. It's actually the same thing that's happening, and it's very saddening. The reason why we are able to remove the insulin from our patients is because we are trying to treat the insulin resistance. So how do we treat the insulin resistance? There's an insulin resistance now. Is it the problem with insulin? No, not exactly. The problem is, okay, in order to understand insulin resistance, we need to understand this from another point of view. Okay, so we know every single cell, for them to function, they need the glucose to enter from the bloodstream into the cell. And in order for them to enter, there's actually a door for them to enter. There's a lock. And this lock has to be opened by the insulin. So this is the key now. So this is insulin. So insulin has to go and unlock the door, open, so that the glucose can come in. However, when we have too much of this insulin in our body, because we eat too much of carbohydrates, 60-70% of our diet consists of carbohydrate. Too much of carbohydrate leads to too much of insulin. And what happens? The door is now spoiled. So the lock is actually spoiled. Insulin is still functioning well. That's why initially our body is able to compensate by producing more of this insulin, more of this key. All right, this is how it actually happens. So now we need to repair the door. How to repair the door? Do we repair the door by giving more keys to the patient? No, it's going to spoil the door. It's going to make the door worse. This is the reason why you notice insulin most of the time is a chronic, progressively worsening disease. But in our experience, we notice that this is not true, because diabetes is a very much reversible condition. Not just diabetes, but also hypertension and obesity. Because why? Because the root cause is exactly the same. It's insulin resistance. It's too much of insulin. Okay, so in order to rest the door, what do we do now? We need lesser insulin. We don't need more insulin. Just like what Prof mentioned to me just now, you need to drink lesser alcohol, you need to taper off. We need to taper off the insulin. How do we taper off the insulin? It's by reducing carbohydrate that is in our diet. Because it's the carbohydrate that stimulates the pancreas to release insulin. So now, we need to reduce the insulin by reducing the carbohydrates. So the treatment here is by reducing the amount of carbohydrate that we take into our body. Okay. So let us see how many of you here, okay, obviously are actually interested to prevent or reverse obesity, diabetes, or hypertension. Let's start the poll. Wow. Okay. Well, this is quite probably a no-brainer question. All right, we have 100%. Oh, we actually have a no. Surprise, surprise. Okay, okay.
So
All
let
right,
me
I
know
think we
when to
can.
end the poll.
Yeah, I think we can end the poll. Yep. Okay. So, all right. So since most of you want to know how to actually reverse it, we will reveal the answer now on how exactly we can actually reverse this diabetes, hypertension, as well as this obesity. Okay, let us move on. So going back to that root cause just now, okay, there are three methods to go about. I'm going to review the three methods first. First one is called the low carbohydrate, high fat diet plan. Next one is called the intermittent fasting. And the next one is exercise. You notice I put an asterisk over the exercise, okay? Because exercise does help in terms of a better muscle tone, okay? It does help in terms of regulating blood sugar to a certain extent. However, when it comes to reducing weight, exercise, I'm sorry to say, doesn't really work. Then there have been studies, okay, talking about, you know, how exercise, you know, is actually not that useful. And I'm not sure how many of you have actually, you know, come across people who have been exercising all their life, but you notice they are still overweight and they're still suffering from diabetes and they're still suffering from hypertension. We have also probably seen a lot of, they're also in the newspaper, you know, they say people who are playing badminton or they're running on the treadmill or not treadmill, I mean, they're running in the jogging track and then suddenly they just drop dead. Okay, and we do know that most of these are due to cardiac problems. So, and many a times exercise doesn't really work. This also because of another reason. You see, what happens to us after we exercise? We feel hungry, right? So when we feel hungry after a bout of exercise, okay, our appetites improve. We end up eating a plate of fried rice, a plate of nasi lemak and things like that. And just think about it. Do you think that the calorie that you burn during your episode exercise is actually higher, the calorie is higher, or the plate of nasi lemak has got higher calories? All right. And we know what is the answer, okay? So we know most likely it's actually because most likely the calorie from the plate of nasi lemak is actually more. So that means you will never be able to outrun the diet. You will never be able to outrun the plate of nasi lemak that you have just taken after your jogging, okay? This is the reason why the more we exercise, actually sometimes the worse you become, okay? I've personally never seen anybody who exercise their way out of obesity, diabetes, and hypertension. Most of them, even if it work, it will only work for a while. Why? Because most of the diet plan out there causes a lot of hunger in them. Exercise causes hunger. Okay, a lot of low-fat diet plan also cause a lot of hunger in them. Okay, this is the reason why most of the time it doesn't really work. Now, coming back to low carbohydrate, high fat diet plan. So we mentioned that just now, you see, in order to reverse this diabetes, you need to basically treat this insulin resistance. To treat insulin resistance, you need less insulin. To need If you need less insulin, meaning you need to have lesser carbohydrate that stimulate insulin. So low carbohydrate, high fat diet plan is the way to go. And how do we go about is actually by reversing the food pyramid upside down, meaning we put the fats below now. Okay, so our patients take about 60% of good fat. Okay, good fat now, good fat. And then followed by protein. There's no change in terms of protein when it comes to the percentage. And then finally on top will be the carbohydrates. Okay, so this is called low carbohydrate, high fat diet plan. It's not no carb, there is still carbs because patients are still taking some green leafy vegetables. Patients are still taking berries and things like that. Okay, so low carbohydrate, high fat. Most of our patients, we will start them off with this diet plan, low carbohydrate, high fat. Some of you might be more familiar with another term called the ketogenic diet plan. Just for information, ketosis, okay, we call this a nutritional ketosis when you go on ketogenic diet plan, is different from this diabetic ketoacidosis. Is completely different, okay? So we have never seen any patients who are on keto diet plan and then they end up with a ketoacidosis, okay? It's two different things altogether. And then the next one is intermittent fasting. So intermittent fasting, what we do is we actually make the patient fast for 16 hours and then they eat for 8 hours. Okay. And if you, and some people might think that, oh, yo, this fasting is a bit too extreme. It cannot be done. Just for information, every one of us fast at night. When we are sleeping, we are fasting. This is the reason why the first meal of the day is called breakfast. Okay, so this is where the word actually came from. So every one of us fast, so there's actually no problem of doing that. And if you notice, almost every single religion also practice fasting. Whether they are the Muslims, they fast once a year. Whether they are the Buddhists or whether even Christians, they do fasting and prayer and things like that. So fasting has been recognized as a very good way of actually treating a lot of diseases, including diabetes, hypertension, as well as obesity. So our patients most of the time they skip breakfast in terms of when it comes to IF. All right. So these are the three methods, and especially the first two are very important because the diet, the first two actually constitute 80%. So 80% of it actually come from diet, and only a small little 20% come from exercise. So now the next question is, are we the one who actually found out about this? Not really. We didn't find out about this. Can we really reverse obesity, diabetes, hypertension? Are we the only one? Is Dr. Jasmine and myself, are we the only doctors who actually know about this, or we came up with this? No, we actually didn't invent the wheel. We just found out about this probably slightly earlier than most people. And of course, I was insistent about this because of what happened to me, the misdiagnosis of the pancreatic cancer. Let's take a look of this. This lady, her name is Dr. Sarah Horberg. She's from US. She is the one who inspired me to do what I do now to reverse diabetes. And I was, because Prof. Som has already mentioned that, I'm into this public speaking, I joined Toastmasters. So obviously TED Talk is one of the very important inspiration for me. So I watch a lot of TED Talks, and this is what I found. Okay, reverse diabetes by ignoring the guidelines. So since she's from US, the guidelines that she's talking about is actually the ADA guidelines, the American Diabetes Association guidelines. And I was shocked when I first saw this particular video, this particular YouTube video. By the way, this is from YouTube. All right. And I was like, I just couldn't believe it. Are you serious? I was like, Doctor Sarah, are you serious? Your patients are taking steak, they're eating steak, all this lamb, beef, and all this seafood and things like that, and yet you are able to throw away their medication. I just couldn't believe it. So I will understand if some of you now, you are probably in disbelief, because this was how I felt. This was back in 2017, okay, when I first actually came across this. And of course, I decided to go ahead and do further research before I actually started prescribing this to my patient. Followed by the next one, Dr. Jason Fung. When it comes to reversing diabetes, Dr. Jason Fung is definitely the #1 guru in the whole world, not just in his country, Canada, but the whole world. So a little background about this guy. Dr. Jason Fung is a Canadian nephrologist. So he must be, okay, he is a world leading expert, okay, on intermittent fasting, which is what I mentioned just now, and low carb, high fat, especially for treating people with type 2 diabetes. So how in the world he started this was this. As a nephrologist, okay, so obviously he has seen a lot of patients who came in with, end stage kidney failure, and, they have to undergo either a dialysis or they have to go for transplant and things like that. So it was very disheartening to him, because by the time they see him, it's too late. So what happened? So he said, okay, fine. So since, I'm not able to do anything here, let's find out what is the root cause of those kidney failure. And he realized that most of them are actually diabetic. We know that 2/3 of the kidney failure patients are actually diabetic. So therefore, he found that it was actually diabetes. And then he found that no, these patients who are on the regular management of diabetes is not doing they are not doing any better because they still continue to have kidney failure despite taking the medications and insulin and things like that. So that's how he found out about this intermittent fasting and low carb effect, where he helped so many patients to reverse diabetes. You can just search for his name, okay, after this, or obviously, and you can see tons of information, okay, tons of videos that he has actually made in terms of coming to intermittent fasting and low carb high fat. And today I learned a great deal from him as well. Okay, we are talking about Canada as well as US. Let's come closer to Malaysia now. Can someone tell me who exactly is this? Probably, okay, to save time, probably we just ask our prof. Prof, can you recognize this hero of ours?
I think others can put in the chat box.
Oh, okay. Yeah.
Yeah.
Yeah. Do we have
Someone
some
already
answers?
wrote that.
Okay.
Tan Sri Sam.
Yes. Okay. All right. Got it. Okay. So, Tan Sri Hisham, okay, he is a well-respected doctor. We know without him, we probably wouldn't be where we are today, okay, in Malaysia in terms of managing COVID-19. Let's check out what exactly he wrote on his Facebook page 2 years ago. Okay, so not impossible that type 2 diabetes can be reversed and cured. Okay, I don't dare to use the word cure until today. I'm only using the word reverse in just 4 months by cutting calories, exercising, and keeping glucose under control. A trial has shown. All right. So for us, it's between 4 to 6 months. All right. And so this is what he has shown even 2-3 years ago. Okay. The question is, are we going on to the bandwagon or are we not going on to the bandwagon? All right, this is one of the clinical study that was actually done. All right, and I've actually shared the link here. You can actually spend some time, go to vertahealth.com. So this is what they have is a long-term effect of novel continuous remote care intervention during nutritional ketosis for the management of type 2 diabetes, a 2-year non-randomized clinical trial. All right, let's check out some of the results. Okay, so you can see here, the first one here, this bar is Verta Health, meaning these are the patients who are on low carbohydrate, high fat diet, okay, plus intermittent fasting. And this is the one that is under the usual care. And as you can see at 2 years, the diabetes reversal is actually pretty high. All right. And of course, they still have the remission group, okay, and of course, the complete remission group here. And as you can see over here, it's actually pretty low. And then next one. All right, so percent of trial completers prescribed diabetes specific medication. So the number of medication that is required over from baseline or 1 year and 2 years. You can see how the percentage for the Verta Health, the light blue, 55.7 dropped to 26.3 and at 26.8. This is probably due to lack of compliance to the diet plan that is actually increasing. But you can see in the usual care, it's actually increasing in trend, which is not something that is too surprising because that's very common for patients who are actually prescribed with OHA as well as insulin injections. Next up, we see this one. This is more for insulin dosage. You can see that how the insulin dosage actually drop. Some patients are faster, some patients are slower. From 81.9 units per day, drop down to only about 15.5 units per day. And as you can see in the usual care, it's the same. It's continue to go up and up and up. It's higher and higher. All right. Okay, so for those of you who are interested to know more, okay, we don't have any products or services to sell exactly at this point of time, but this is the link you can go to. We will have our next health talk in English, all right, and so you just to go to this link. All right, if you need more information about this ketogenic low carb high fat diet plan that can help in terms of diabetes, hypertension, and obesity, this dietdoctor.com is a very reliable site for you to go to. I'm actually a prescriber to it, and I learned a lot of my information because you see there are a lot of fake informations online as well. So you can see that global map, they there's 568 clinicians around the world. In Malaysia, there are 5 of us, and 2 of us are actually here right now, okay? Myself and Dr. Jasmine. I want to challenge Malacca Manipal Medical College at this point of time. Okay, by the way, it takes a bit of courage for me to actually say this. To actually do a clinical study, okay? I run a wellness center, and obviously I do not have the capacity to run a clinical study in Malaysia with regards to low carbohydrate, high fat diet plans. I would like to challenge Malacca Manipal to take up this, the lecturers and the professors in Malacca Manipal to take up this challenge to actually conduct a clinical study on this and see whether it actually works or not. And because this is going to be life-saving, it's going to help patients to save not just their life, but also a lot of time and also a lot of money. And yeah, that's about it. Any questions?
Yeah, thank you, Andrew, for giving us some ideas on how to fight obesity and as well as the reversal of diabetes. So maybe you have we have 4 questions here, and 1 question will be from me. So maybe we'll just stop the sharing so that,
Oh, okay.
The first question is coming from Dr. Rajiv. Does the low carbohydrate, high fat equally effective for non-diabetic obese person?
Yes, it is equally effective. In fact, it is very effective. And there are a lot of people who have been using this ketogenic low carb, high fat diet plan to actually lose weight. The benefit of using this to lose weight is that patients actually don't feel hungry because the fats and the proteins actually makes us full. Many of us thought that obesity is a behavioral problem, but in fact, it is not. It's actually not so much of a behavioral problem. It's a hormonal problem. And the hormone that we are talking about here is insulin. And when we apply low carbohydrate, high fat diet plan, because patients ingest fats and protein, and this is actually going to stimulate this ghrelin hormone in us to make us full. You see, you notice that throughout the world, we tend to take too many meals a day, 6 meals a day. Why? Because when we take carbohydrates, the graph tend to be in a yo-yo effect. It just goes up, and then within 2 hours, it will drop. And our initial satiety signal only comes from the stretching of our stomach, which doesn't last too long because we know that the stomach emptying time is between 2 to 4 hours. So we need the hormone, the ghrelin hormone, to actually help us stay satiated. So in this low carbohydrate, high fat diet plan, patients only take 2 to 3 meals a day. The best part, they don't even really have to go and exercise. And it's very effective because they end up not having they don't have that craving for carbohydrates anymore.
Okay, there's one more question. This is from Prof. Nan. How much protein, minimum intake, fat intake, and carbs for 1 day, per day? How much one should take minimum?
Okay, for my patients, we don't really do calculations, but when it comes to the original pyramid versus the ketogenic diet plan, the protein, there's actually no change in terms of protein. It's about 30%. 30% protein, and instead of having 60% carbohydrate, we switch the 60% to fats. So the protein is actually the same, and it's very difficult to overconsume fats and protein. The reason is because of what I just mentioned just now, because this satiety hormone is being stimulated by fats and protein, but it's very easy to overconsume carbohydrates. Yeah.
But usually, Andrew, sometimes they say it's easy to divide a plate into 3 into half should be quarter should be carbs and half should be veggie and half should be protein or something like that.
Yeah,
isn't that an easier way of?
Okay, so for my patient, okay, we do it in a very practical manner. I will tell my patients, look, when you go and take a lunch, this is what you do. 1/3 of your plate will be green leafy vegetables. Okay, because they're not allowed to take starchy vegetables. Okay, because actually today I don't have time to go in depth into keto diet plan. Okay, so if Prof. Sam, if you're willing, I don't mind coming in again to actually share in depth about this diet plan, what to eat, what not to eat. But generally speaking, my patients, their plate, I will divide into 3 parts. 1/3 will be green leafy vegetables. Another 1/3 will be meat. Okay, this meat will include this red meat and also white meat. That means chicken, fish, all the seafood, and then they take pork, they take beef, they take lamb, and things like that. 1/3, and then the final 1/3 will be eggs. and also proteins and things like that. So the whole plate is full. My patients, they eat only when they are hungry. They stop when they are full, because we have the signal automatically sent to us telling us that this is enough. Okay, I have enough of food, and that's about it. So they don't really count the calories when it comes to the diet plan.
This one is from Prof. Nachi. Will diabetics go hypo with intermittent fasting and still on insulin or oral hypoglycemics?
Yes, they will. This is the reason why, remember just now I actually shared one of the testimony. This is exactly the reason why I shared it. So in our case, when we manage our patients, we never start them off with IF. IF is always the second stage. The stage one that when we first start them off is always this low carb, high fat diet plan first. And with that also, we are very careful. We are very careful because we have to actually taper off their insulin injection so slowly. So when the first come, let's say well, of course, it's also based on experience and also how we actually gauge the patient. If you realize that I think this patient is going to be very, very disciplined, very strict, we will immediately drop the insulin injection during the first consultation itself. And we usually taper off around 30% of the insulin. Let's say the patient is injecting 30 units. We will immediately drop to probably about 20 units, and then we let them go for 2 weeks. So we see them in a very tight, the window is actually very tight. So in 2 weeks time, we will get them back ready. We'll get them back, and we need them to do very tight monitoring on a daily basis. They have to do fasting blood sugar for us. They have to do 2 hours after their meal sugar for us. So that from there, we can gauge how is their sugar. And I think I already showed one sample just now. You can see in the sample just now, that's how tight we actually gauge them. So in 2 weeks time, we will see them back, and then we will try to remove their medication, whichever necessary.
Thank you, Andrew.
So for patient, we never start them on IF unless the medication they're having now is OD dose. Only on daily dosing we can actually start them on IF. If they're still on BD dose, we never start IF first.
Thank you. Another question. This is from Dr. Dubey, who's an ENT surgeon. I'm interested in knowing nasal obstruction complaint and sleep pattern in patients with resistant diabetes and obesity during your practice. Did you come across nasal obstruction, sleep apnea or something like that?
Okay, because this is what I have learned last time. I mean, I think I remember even during college time, one of the most important, one of the front line in terms of coming to treating sleep apnea is actually to reduce weight. At this moment now, I cannot really recall any of my patients complaining about this. In terms of sleep apnea, but I believe if their weight is being reduced, I believe their sleep apnea will also improve tremendously. Just for information, while treating patients, we actually do have a lot of patients with gastritis, as well as gout, okay, who actually improve automatically by themselves. Even though we were not focusing on that. We also have patients who have eczema. A lot of these autoimmune disease patients, when they come on board to us, they notice that these symptoms of them actually improve as well. I couldn't believe it initially because I was like, I told my patient came to him and I said, hey, you know what, doctor, I've not been suffering from gastric for some time. And I was like, okay, that's nothing to do with me. That's good for you. And then I was like, oh yeah, that's good for you lah, nothing to do with me, because I was not focusing on your gastric, I was focusing on your diabetes. And then when more and more patients come back to me with the same response, I start to realize, yes, gastritis is also actually being affected, and they will also improve. And one of the reasons is because carbohydrates also can actually lead to this, what we call gastritis, because carbohydrates per se is very inflammatory. So this is why for autoimmune disease patient, this ketogenic diet plan is also very helpful to them. Not forgetting cancer patients. One of the way to help cancer patients is to actually prescribe ketogenic diet plan. So if you remember, in cancer patients, one of the scans that we do for them is that, what is that scan called? Something I cannot remember. The one that we put in the fluorescent dye. Can someone help me? What is that scan called?
Fluorescent dye where?
We put the dye in them, and then we put the dye in them, and then we take a picture, and then their whole body will become radioactive, and then we will snapshot. What is that scan called? I suddenly cannot remember.
PET scan?
PET scan. Yes, PET scan. Okay, so what is the principle behind PET scan? PET scan is actually where this, because what we are actually injecting is actually sugar, just as this sugar is tagged with fluorescent. And this sugar will actually go to the spots where there is actually a lot of active cancer cells. So you see, if we starve the cancer cells with sugar, basically they die. Yeah, so that's actually another indication to prescribe ketogenic diet plan.
Right. Thank you. There's actually two questions, similar question. Is there any vegetarian diet plans?
Yes, there is.
For those who are vegetarian.
Yes, there is. Dr. Jasmine is currently handling, I think, at least 2 or 3 vegetarian patients who are actually on keto, who are on keto now at this moment. It's a little bit more difficult because they have lesser choice, but they can.
Okay. And one more question from Dr. Katija is for mothers who are pregnant or breastfeeding, is it okay for them to go on keto diet since keto diet avoids cow milk consumption?
Okay, it's actually not advisable. The max they can do is low carb. They never go on keto. So the best is actually still allow them to actually take some carbs. Yeah.
Right. The next question is from Dr. Gulpreet. With 50 to 60% fats in the diet, what is the risk of hypertension and cardiac problem in obese patient?
Okay, so because the fats that we are talking about here, we are talking about good fats. And my understanding is every time we take cholesterol, the cholesterol reading from our patients, 80% of the cholesterol is actually from our own body. Our body, our liver produces cholesterol. It's 80%. It's only a small 20% which actually came from food. And we have been taught in a way that saying that LDL is bad cholesterol. But frankly speaking, back then in the college time, I do not remember LDL being bad. Okay, LDL being a bad cholesterol back in the college days. But I started hearing that when I came out, to practice. So when everyone keeps thinking that LDL is bad, the question is LDL really bad? Considering that 80% of it are actually produced by our own body. Now we do know that LDL and also HDL, they're actually a form of transporter because we know fats cannot travel in the blood by itself. Fats and protein has to come together, okay, because it has to cling together. So HDL and LDL, are they really bad? I mean, we all know HDL is good, okay, but LDL, is it really bad? The answer is actually partially right only. Why? The way we read cholesterol profile, lipid profile for our patient, when it comes to LDL, we actually read the HDL and the triglyceride as well, okay? I think we all agree that triglyceride is bad for us. And we probably also know that patients who are on ketogenic diet plan, their triglycerides improve like crazy, okay? The triglycerides just drop and their HDL will actually increase. So how do we read an LDL is, if the HDL is high, which is what we want, and the triglyceride is low, which is also what we want, then we know that the LDL, okay, is on the good side, okay? Because my understanding, LDL has got 2 different particles. Actually, there are more, but we focus only on 2. The A particle and the B particle. A particle is what we call the large, fluffy particle, which doesn't block our vessels. B is what we call the small and dense particle, which is the bad LDLs. So how do we know whether the patient has got more LDL A or LDL B is by looking at triglyceride and HDL. The higher the HDL, the lower the triglyceride, the more A this patient has. Means we don't have to worry anything about the heart risk and things like that. But if the reverse is true, HDL is low, triglyceride is high, means this patient has got more B, which is something that we have to worry about. Yeah. So most of our patients, of course, we have the first pattern, the pattern A to be actually higher. Which is not so worrying for us. And we also do CRP and all those ESR to actually look into other parameters of our patients as well. So the risk of it actually goes down and not go up.
Okay, thank you. One more question. This is from Ms. Johanna. Most keto diet plan or meal is expensive. Is there a cheaper version of keto diet?
Okay, you're completely right, Johanna. Okay, the keto meals are expensive is because how the society has actually framed the whole thing. Because you see, carbohydrates are cheap. If you order, you see, it's always cheaper to take a bowl of a fried rice rather than a steak. Okay, but the thing is, I always tell my patient also always complain to me. He say, doctor, the way we eat like that is very expensive. But what I'm gonna share with them is, it's cheaper to eat like this in keto manner than to spend money and buy medications and also in the end probably suffer from the complications. Yeah. If you ask me whether there's any cheaper version, the answer is no. When will the cheaper version come? Probably another 10 to 15 years, when all the pharmaceuticals and when all the food manufacturers start to buy into this idea of low carbohydrate, high fat diet plan, that's when the cheap keto will come. But until then, I don't think it's going to be cheap. It's going to be expensive. But thinking about it, it's actually not really expensive also. People who are on high carb diet plan, they take 6 meals a day. My patient only take 2 to 3 meals a day. So in a way, they are also saving money. They are just buying higher quality food. They don't buy quantity, they buy high quality food.
So another question, do you have a sample of daily menu to share with us? Is there any menu kind of thing, like what I mean is a food plan, I guess, to share this from Melissa?
Okay, we don't really have that because it's very much customized. In fact, to speak about the diet alone, on what not to eat and what to eat, right, that actually takes about actually about 1 hour. Yeah, that's why actually if you're willing, okay, I don't mind coming in again to share with you in exact details what my patients eat, what my patients don't eat. But this is only meant for those who are not on medications. If you're on medications, please don't do it yourself. Yeah. So so we actually have a more of a general plan rather than customized plan, because different patients, of course, they eat differently, and of course, you know, they have their different cultures. Some are vegetarian, some are not, and things like that.
Yeah, menu plan again, like one request, menu plan Indian. So I guess you have to come back again for that. I have one question from my side.
Yep.
I mean, there are various like hours I have seen for intermittent fasting. Like some people has 14, 10, 16, 8,
Yes,
24. Like when we start, do we have to grade it like that, or we can start anyhow?
Okay. It is, I find it is easier to actually start with 16/8, okay, because 16/8 is not so aggressive. It's not so it's not so aggressive. 16/8 is very easy because patients only skip breakfast. Most of the time, we only skip breakfast. Okay, we have all learned that breakfast is the most important meal to skip. Yeah. Okay. If you don't mind, I can share a little bit about breakfast. Actually, most of my patients, they tend to skip breakfast. Okay. How many of us here actually realize? Let's talk about kids. Kids. It's actually quite difficult to feed kids breakfast. It's true. Professor Song, Prof Song? What is your own experience?
Probably yes.
Yeah, it's difficult to feed them breakfast.
Yeah.
Why?
Maybe
Why is it
like
difficult?
rush to
Kids are
school.
innocent, right? They don't know anything, right? Okay.
Yeah.
That's actually why is it difficult to feed kids breakfast. And the same reason applies to, we also notice a lot of our patients, their fasting blood sugar is always higher than their postprandial blood sugar. Okay. So what is the reason? The reason is these two words. It's called the dawn phenomenon. Dawn, as in the sun that's coming up. Dawn phenomenon it happens between 5 a.m. to 8 a.m. It's a 3 hours window. During these 3 hours, our body is preparing ourselves to actually go and work, go and rush for work, to study and whatever we need to do. And it actually releases a lot of hormones, this stress hormone into our body. And it also suppresses our appetite. So see, kids, they're innocent, so they don't know, so they just don't have the appetite to eat. And why is the sugar high? It's because the liver at this point of time is actually doing this process called the gluconeogenesis. We've probably heard of it. Glucose, neogenesis generating. So the liver is generating the glucose and pouring into the bloodstream. And in a diabetic patients, because of because of insulin resistance, they couldn't bring the sugar in. That's why when they do fasting, blood sugar is high. Yep. So breakfast is the best meal to skip. And breakfast doesn't mean it has to be done in the morning. Break the fast, right? You can actually, for me, myself, okay. So a confession to make, I'm not on keto myself. Okay. I still take rice and all these things. But why am I skinny? Why am I fit? It's because I do IF every single day without fail. I only take 2 meals a day. I skip my breakfast. I start working at about 8 plus with my patient's consultation. I usually eat at about 11 plus, 12, and I only take 2 meals a day. Yeah. So my body has got the opportunity to burn off all this glucose and whatever. All right. And I'm also, of course, active in sports. And of course, sports will also help me to burn off the sugar and things like that. The same goes to Dr. Jasmine. Dr. Jasmine is also very active in sports and things like that. Yeah. So skip breakfast.
Okay, I think that should be all.